As we continue exploring the physical aspects of aging, it's important to clearly distinguish between normal aging and pathological aging. This distinction sits at the heart of gerontological practice. A common misconception, both socially and professionally, is that aging itself is a disease. In reality, aging is a natural biological process that involves gradual changes across multiple systems of the body. Aging is essentially something that unites us all because we're all experiencing it. And these biological changes are expected, highly variable, and often manageable. In this lecture, we'll focus specifically on normal age-related changes, the kinds of physical shifts that occur even in the absence of illness. I will briefly introduce pathological aging toward the end, but we'll save a deeper dive into disease processes for the next lecture. Understanding what normally changes with age helps provide us with appropriate care, avoid unnecessary medicalization, and challenge ageist assumptions about decline and dependency.
That's where I'll spend it being point to it. You can have it. That's where.
Before examining specific body systems, let's establish several core principles that guide how gerontologists understand normal physical aging. First, normal aging is gradual. Changes typically unfold over decades, not suddenly. When abrupt or severe changes occur, they often warrant closer clinical attention as they may be signs of something pathologically occurring, like the onset of an acute or chronic disease. Second, aging involves a reduction in physiological reserve. This means that while systems continue to function, they may have less capacity to respond to stressors such as illness, injury, or environmental extremes. Remember in the previous lecture when we discussed biological theories of aging? Many of those theories we discussed are tied to this idea that our bodies have reduced capacity to respond to stressors as we age. Third, aging is highly individualized. Genetics, physical activity, nutrition, occupational exposures, chronic stress, and access to healthcare all influence how aging manifests. While there are biological processes that we all will experience, aging in its totality will be highly influenced by a myriad of individual factors which defines that experience. Finally, many age-related changes are adaptive rather than disabling. We often view aging through the lens of deterioration, but this can be an ageist stereotype as many changes are in fact more adaptive. Older adults often compensate effectively through experience, behavioral adjustments, and environmental supports. With these principles in mind, let's turn to specific systems of the body and what age-related changes we can expect as we grow older.
You can have it. That's where.
The cardiovascular system undergoes several well-documented changes as part of normal aging. One of the most significant changes is a gradual loss of elasticity in blood vessels. Arteries become stiffer over time, which can lead to increases in systolic blood pressure. And importantly, this stiffening is a structural change associated with aging itself. It is not necessarily a sign of cardiovascular disease. The heart muscle may also experience subtle changes. The left ventricle can become slightly thicker and less compliant, meaning it doesn't relax as easily between heartbeats. As a result, the heart's ability to increase output during intense physical activity declines, making some activity more difficult. Additionally, maximum heart rate decreases with age. This means that older adults may fatigue more quickly during exertion, even when cardiovascular health is otherwise good. Despite these changes, many older adults maintain sufficient cardiovascular function through daily activities, moderate exercise, and active lifestyles. These shifts reflect reduced capacity at the extremes, not an inability to function.
You can have it. That's where.
The musculoskeletal system is central to mobility, balance, and independence, and it undergoes several predictable changes with age. One key change is a gradual loss of skeletal muscle mass and strength, a process known as sarcopenia. Muscle fibers shrink in size, and the body becomes less efficient at repairing and rebuilding muscle tissue. This can result in reduced strength and endurance over time. Bone remodeling also changes with age. Bone resorption begins to outpace bone formation, leading to gradual declines in bone density. This process occurs in both men and women, though it tends to accelerate in women after menopause. Joints may become less flexible due to changes in cartilage and connective tissue, and tendons and ligaments lose some elasticity, which can affect range of motion and recovery from strain. Crucially, these changes are not inherently disabling. Regular physical activity, particularly resistance and weight bearing exercise, can slow musculoskeletal decline and preserve function well into later life. Age related changes in the sensory systems are common and often noticeable, even among otherwise healthy older adults. In the visual system, normal aging may involve reduced pupil size, decreased lens flexibility, and changes in retinal function. These changes can lead to difficulty focusing on close objects, reduced contrast sensitivity, and challenges seeing in low light conditions. In the auditory system, age related hearing loss or presbycusis is common. This typically affects higher frequency sounds first and can make it harder to understand speech, especially in environments with background noise. Changes in taste and smell sensitivity may also occur due to alterations in sensory receptors and neural processing. While subtle, these changes can influence nutrition, appetite, and safety, such as detecting spoiled food or gas leaks. These sensory changes are expected components of normal aging, but can have major impacts on the quality of life of an older person. However, when addressed through environmental modifications, assistive devices, and communication strategies, their impact on daily life can be significantly reduced. As healthcare professionals, we must be mindful of ensuring appropriate accommodation for older adults potentially experiencing these normal sensory changes. The nervous system also shows normal age related changes that affect motor and cognitive functioning, which we'll address here briefly. I'll point out, though, that we'll go into more detail on changes in cognition in a later module. Reaction times tend to slow with age due to changes in neural conduction speed and synaptic efficiency. Balance and coordination may also be affected, increasing vulnerability to falls under certain conditions. Processing speed, the rate at which information is perceived and acted upon, may decline modestly. However, accumulated knowledge, experience, and reasoning abilities often remain strong or even improve with age. It's critical to emphasize that normal cognitive aging is not synonymous with dementia. Most older adults retain functional cognition and adapt effectively to subtle changes through compensatory strategies. As will be discussed in a later module, while some cognitive changes are normal, dementia is pathological and not considered to be a part of the normal aging process. Speaking of pathological, while the changes we've discussed so far are part of normal aging, it's important to briefly acknowledge pathological aging, which involves disease processes that go beyond typical age-related change. Conditions such as cardiovascular disease, osteoporosis, arthritis, and neurodegenerative disorders involve structural or functional impairments that are not inevitable outcomes of aging. Although the risk of chronic disease increases with age, many older adults experience aging without major pathology. Distinguishing normal change from disease is essential for appropriate diagnosis, treatment, and support. We'll explore pathological aging and chronic conditions in much greater detail in the next lecture. Understanding normal age-related changes has important implications across healthcare, social services, and policy. For professionals working with older adults, this knowledge supports accurate assessment of function, avoidance of unnecessary interventions, promotion of independence and adaptation, and development of age-friendly environments and systems. For healthcare administrators in particular, recognizing normal aging helps inform service design, resource allocation, and preventative strategies that support well-being rather than focusing solely on disease. It also plays a critical role in reducing ageism. When normal aging is misunderstood or pathologized, older adults may be viewed as inherently frail or incapable, assumptions that can limit autonomy and reinforce inequities. To summarize, normal aging involves predictable physical changes across multiple body systems. These changes reflect gradual shifts in function, resilience, and adaptability, not inevitable illness or decline. By understanding what typically changes with age, we are better equipped to support older adults respectfully, design responsive systems, and distinguish normal aging from pathology. In the next lecture, we'll turn our attention more fully to pathological aging, examining chronic conditions that affect older adults and how they differ from the normal processes discussed here. As you move forward, consider this question. How might misunderstanding normal aging contribute to unnecessary medicalization or ageism in the systems or organizations you work within? This concludes the second lecture in Module 2. If you have any questions about the material covered in this lecture, please contact your instructor for this course. Thanks for watching.
Only to it. You can have it. That's where I'll spend it, baby.